Welcome to Unscripted. I'm your host, Bryce Curry. In this series, we have candid one-on-one conversations with physicians about common topics that doctors experience along their journey. On today's show, we'll be sitting down with Dr. David Hall to talk about the importance of fitness and nutrition and creating boundaries in your life. Welcome to today's episode of Unscripted. Today's guest is Dr. Hall, and I'm super excited to have him on today's episode and get a chance to talk a little bit about his passion and what got him into medicine, and go through a couple tips that got him through through residency and fellowship, and also have some exciting news at the end to kind of share with everybody as well. So, Dr. Hall, thanks for joining me on Unscripted today.
Yeah, thanks. I'm really excited to be here. I appreciate the opportunity, and yeah, I'm excited to chat.
Yeah. So let's start kind of with the now, and then we'll go kind of back in time a little bit. So I think it's good to establish kind of like what are you doing right now? What's your focus, and share a little bit about kind of your what you're currently doing.
Yeah. So yeah, I'm a board certified urologist. I've been doing that 12 years, finished residency in 2012. And I'm just outside Indianapolis in private practice and been basically in the same spot since residency. Really good group, good patients, just love where I practice. I do a lot of men's health. So over the years, I've really enjoyed treating a lot of low testosterone, a lot of men's health issues, and been a lifelong lover of fitness and health and wellness. So I've since become a wellness coach and a personal trainer also. And combining the men's health expertise and the wellness coaching and fitness coaching, I've kind of put it all together in a new startup, kind of a wellness company that I launched not too long ago called Fit and Fine. And we specialize in helping busy professional guys just try to get in the best shape of their lives. Because I've seen how, especially my patients, my men's health patients in urology, they get busy and they get distracted, and, I can treat the low T, but it's so much more than that, right? There's like a holistic piece to helping those guys. And so that's kind of where I'm at, I guess, professionally. So I like talking a lot about the low testosterone and men's health and fitness and wellness and nutrition and all the things that go along with that.
Dr. Hall's a great follow, and we'll share all your socials
Thank you.
on LinkedIn, and have actually used some of the stuff he's posted in my own personal conversations with my doctor on some stuff. So,
nice.
From a I guess I'll call it a consumer standpoint, some really great content.
Thank you.
Today, what I want to kind of even look back in time a little bit. And go back and just ask you a couple questions, because our goal here today is to enrich and empower and encourage the individuals that are the next generation of medical professionals. So individuals that are currently in residency or fellowship, or even coming out of medical school. And I always like to start with what got you into medicine. Was there a certain thing that occurred in your life, or just an interest in biology? What got you in the medical field to start with?
Yeah, it's kind of an interesting story. I actually wanted to do a lot of other things outside of medicine. I never thought medicine would be a thing I'd want to go into. I wanted to do things like financial planning, wanted to be a stockbroker, thought about being a meteorologist for a while. I really liked weather patterns and that kind of science aspect of things. And so it was actually a science teacher. I had this chemistry teacher in high school who was phenomenal. And that was the first time I actually thought, science was pretty cool. She just a great teacher, just kind of one of those, just kind of helped develop that interest in me at the time. And it turns out her husband was actually a physician. And so I kind of met him and started talking about how science and medicine intersect. And I've always loved people, loved working with people, and wanted to help people. And so I started playing with the idea of like actually combining the love of science, now medicine, and wanting to help people. And that's kind of what sparked it, that interest to look into that journey, to kind of go down that road. But it was kind of late in high school that happened, and then kind of been all in ever since.
Yeah. Awesome. And then as you were going through your medical education, what kind of brought you to urology or as a specialty?
Yeah. So I think when you hit all along the way, you're in pre-med and people ask you what kind of doctor you want to be. And you're like, I have no idea. Right. I mean, there's so many different options and they're all very different from a personality standpoint. You find different specialties have different personalities. There's even just different levels of expertise required and, skills that are required for different specialties. So you kind of learn that as you go along, but I think most people that say they want to be a specific specialty, I found that they usually change. So I just kind of said, I don't know. I think I want to be some type of surgeon. And so I said that for really all through pre-med. And it wasn't until like middle of the way through med school, I think it was second year, I met actually a couple of urology residents in the gym of all places. And we started talking. They kind of said, hey, what do you do? And I told them I was a med student and asked what they did. They said they were urology residents. And I didn't really know much about urology at the time. Other than I knew it had to do with the kidneys. So they kind of explained it a bit. And then they invited me to come hang out with them in the OR. And so I did that. And I was just mind blown at how cool it was. And so I think I went and watched a bunch of kidney stone procedures that day and maybe some kidney cancer surgeries. And for me, what drew me to that specialty was the diversity and kind of the patient satisfaction piece where you can take an acute issue like a stone and like immediately take care of it. And so the patients are just super happy, super thankful. There's like an immediacy to your skill set, which is in contrast to other specialties like, maybe ER, you see patients, you never see them again, right? You don't really know what happened. Or primary care doctors where you might give medications and then you don't see them back for months and it might have maybe adjusted their blood pressure a bit, but the patients don't actually feel that, right? So for me, there was a technical side, but also a patient satisfaction side to urology that was just honestly kind of beautiful. And so I then kind of went through and tried some other things, right? I tried ortho and plastics and tried to go through other specialties just to see if there's anything else I wanted to do, but it all kept coming back to urology. And so just like the educational aspects, the technical aspects is very diverse. And I also like the anatomy that you would, operate on within urology. And so that's kind of how I came to love urology.
Yeah. It's an amazing journey. And, again, it's a view into how important mentors can be, and also just, asking questions and getting that experience or exposure, I should say, right?
Yes.
So even if we go just a little bit more specific in that time, one of the things I like to ask on this podcast, unscripted, is kind of that old question of if you could go back in time, during your residency, or if you want to go even back further, but that critical time between residency and then into fellowship and so forth, what are some things when you reflect on that you're really glad that you did? What got you through it?
I mean, honestly, I'd say it really started somewhat towards the end of college. I had a couple buddies who were very big into fitness. One was a biology major, so not necessarily pre-med, but we had some classes together. And he wanted some help with some of the educational aspects. And then I wanted some of the help of learning more about fitness and nutrition and working out. And so he and I became kind of workout buddies towards the end of college. And that to me became a really amazing way to number one, let off stress, right? I was able to go exercise and then it just helped me be disciplined in certain areas. The more you work out, the more you make progress, the better you feel, the more energy you have, and it just kind of all keeps snowballing from there. And that carried out really into med school as well. It was just a really integral part of my routine that I think a lot of people didn't necessarily have. And so I don't know that a lot of people that I was around had necessarily, I'll call it a hobby, I guess, but it's not really a hobby, but they were able to, it was harder for them maybe to like unwind or have an outlet. Whereas I had this like pretty routine outlet to help me with my stress. And, I think the more I worked out, the better I felt, the better I slept. And again, it just all kind of, I think, snowballed from there. But that really carried into residency as well. But that was a little more challenging at times. Like, right, it's you have less and less time the further you go along. And so it was really hard to carve out that time and block out that time. And there were times when I couldn't, right? But when I could, and I tried to just fight for that time, it was just super important for me to do that. I'm looking back, I'm so glad I did. And, it's what's continued even to this day. It just gets me through a lot of rough days, right? I can just go to the gym for an hour and just put some, ear pods on and just listen to music, work out. And, I think it just is a great way to, um, uh, make it through whatever you're going through,
Yeah.
at least for me. So,
Yeah. And I, being in business, I can, that's my outlet. If I don't go do my run or lift the weights or get a swim in, um,
mhm.
it's hard to focus, and there's a
Yeah.
lot of benefit to it.
Yeah.
And I appreciate what you're saying, because just a little peek into when we were first kind of starting Influent, we did some market research, and a lot of the conversations were exactly around what you're talking about, and that is, um, but it's more like I want to carve out time for fitness,
Mhm.
but I don't have an hour,
Mhm.
or I have to be on rotation or something like that, and I don't know, what I should do. Is there any, maybe some, I don't want to say practical tips, but maybe some quick tips that you could provide, somebody that's in fellowship that is obviously, better than me, but I would assume sleep deprived, you got the
Mhm.
stress of what you're doing.
Mhm.
But you also know, hey, I need, is there a way to kind of carve out 15, 30 minutes, or is it, you know, any kind of advice
Yeah.
that you might have?
Yeah, yeah. No, I mean, it is challenging in residency and fellowship, right? You really don't have much time, or at least you were told you don't have much time, and you often think you don't. So I think if you make it a priority, you can carve out, 15, 30 minutes, maybe a little more. And again, you don't have to do it every day, right? If you do it 3 or 4 times a week, that should be sufficient. And I recall being on call, and some days you couldn't do anything, but you can make decisions like take the stairs, not the elevator. You can eat a little better that day rather than eat junk. You're just going to feel better. And so I, I think for me, another thing that really was beneficial is learning I don't have to actually go to the gym. I don't need weights necessarily. I can use my body. I can use bands. There's a lot of different ways to actually exercise, even if it's like resistance training that you're after, without going to the actual gym. And so let's say it takes you 10, 15 minutes to drive to the gym, 10, 15 back. If you just take that time and do something at home, then there you go. You can make some time pretty easily. And so I think it's just being aware of how like really devastatingly important it is for like your mental health, your physical health. You're just going to be more energized. You're going to sleep better. You're just going to feel better. And so when you start to really put it at the top of your priority list, you'll realize you can carve out some time. And I think historically, like in college, I thought you needed like an hour and a half, right? You gotta go an hour and a half, you gotta go 5, 6 days a week. And that's not necessary. So I think you have to just make it a priority, and then realize you can take those 15, 30-minute type routines and be consistent with them, and they'll still pay off. Absolutely.
Awesome. And on Fit and Fine, which what's the website? Let's dig into that just a little bit.
Getfitandfine.com.
Getfitandfine.com.
Mm-hmm.
I've gone on there, and it's packed full of some great tips that expand on what you're talking about. And I would encourage our listeners to definitely check out your website, because there's some stuff on there that I've even implemented, and things like take the stairs is something I always remind myself.
Mm-hmm.
Um, so kind of unpacking that, obviously fitness has become a priority. It was a priority for you. You were very intentional with that, and that's carried into your career, right? So let's
Mm-hmm.
let's talk a little bit about um, what you continue to do with fitness, even beyond maybe your core practice.
Just me personally, or you mean like professionally, or?
Yeah, like so personal training. You mentioned that with Fit and Fine,
Mhm.
Get Fit and Fine, that there's some personal training that
Yeah.
you offer.
Yeah, so I think a lot of guys, and we work just with guys, but honestly, it applies to females too. So all listeners can benefit, and even reading this stuff, you can still apply it to your life if you're a female. But I train just men, and so a lot of times guys will come to us and they say, "I'm too busy, I'm too stressed, I don't know what to do, or I don't know how to stay consistent." I don't know what to eat either, right? I think I'm eating healthy. I think I eat enough protein, but it's a lot of I think, I'm not sure. So we kind of just start by like dialing in what they're doing to really like quantify it and make it objective. And then we tweak it because often they say they're getting enough protein, they're not. They say they're sleeping enough and they're not. They think they're working out and then they're actually not doing. For example, they might be doing chest exercises Monday through Friday. Well, that doesn't really help. You need to have variety. You need to have a pattern and an actual progressive practice to what you're doing. So it's find out what they're doing and then tweaking it. And then the biggest thing is like educating them, right? Educating them on what to do, how to do it. But then ongoing, it's like support, it's accountability. And so personally, I've had my own coach and trainer for years. And just knowing that I have to report to someone, like, just makes all the difference, right? If we're left to our own devices, we talk ourselves out of lots of things, not just within fitness, but with other things.
Mm-hmm.
And so I think that support and that accountability is really like the secret sauce to the whole thing, along with, of course, the education and the training, but it's really that support and accountability that leads to the long-term, like building those habits, building those patterns, building that consistency. And when you do that over time, that's where you then start to see success and progress. And then they get excited, right?
Mm-hmm.
And it's all about building just that long-term play, right? This isn't like hey, we're going to get you to lose 20 pounds in 2 months, right? We that's not what we're trying to do. We're trying to teach them, educate them, and make this like a lifelong lifestyle for them. Because number one, it's going to help everything down the road. Every health problem is going to either prevent or improve them. It's going to help their relationships, it's going to help their professional life. And so it's really a long-term investment in like everything, really.
Mm-hmm.
That's kind of how I approach it with the fit and fine.
Cool. Going back into like the hospital setting or during your residency or fellowship, I'm making a big assumption here, so correct me if I'm wrong. There's probably a break room that's full of donuts or food or something, I don't know, or you're looking for something out of the vending machine quick. Making an assumption. Haven't been at that.
No, you're correct.
Scenario.
You're correct.
Right. So we talked about carving out and being intentional and making a priority of actual physical movement or doing some kind of fitness.
Mm-hmm.
What some tips on meal planning? I mean, is there, if you think about a resident right now, is there something that you would share with them on meal planning, or
Mm-hmm.
how do you make sure you don't come out of your education not feeling great about yourself beyond
Mm-hmm.
just fitness side?
Yeah. No, I mean, I think you have to be very intentional because, it's busy. And especially if you're in surgery, you might be in the OR, so you can't really have food around, right? So you really have to know what you're doing, what your schedule is, where you're at, which usually you kind of have some idea what that might look like. And so, I mean, rule number one, I never left the home without eating breakfast. So just eat breakfast at home, and it can be quick, it can be easy. And most of the time, my breakfast was a lot quicker than most people waited in the Starbucks line or whatever it might be, right? I can have pre-made egg whites. I can quickly microwave egg whites. I can make instant oats. I can add fruit to instant oats. I can eat almond butter in my oats or peanut butter, whatever it might be. So a lot of that stuff you can have pre-made or make it, Insta. It can be very quick. And so those are really easy to do. It's going to be quicker than what you might wait in line for at the hospital anyway, and it's gonna be a lot healthier. So that's rule number one. I would not skip breakfast. And then rule number two, I think, is just going through the day, have some idea of how you're going to get protein, good carbs, whatever it might be throughout the day. And often that's just packing things, right? Things that can be eaten quickly and on the go. And so for me, honestly, looking back, I didn't have the greatest idea around nutrition, but I knew I needed food. So I would eat protein bars. I had like 2 a day, maybe 3 a day on days I couldn't get to like real food.
Mm-hmm.
But that was honestly better than like not eating for like 10 hours, right? If I don't eat, my metabolism's going to tank, my muscles going to, catabolize. And so I think for me, just eating those protein bars throughout the day were great. And they're not all created equal. So I think that the modern me doesn't really eat them at all. I mean, there's some that are better than others. So if you're going to eat them, just try to get really good, high quality ones. Other things, I would make like little sandwiches with like really great bagels and like lean chicken that's pre-made, and have those in my locker, right? And so like between cases, I could run to the OR locker room and eat real quick. Now it's not ideal, right? It's not a lunch break. I'm not sitting down, but I'm at least getting food. And so for me, that was better than like going 8 hours with not eating. And, at home, I mean, obviously once you get home, it's a little easier if you got a fridge, you got an oven, you got a microwave. But I think if you don't do that, if you skip breakfast, you don't eat a protein bar, lunchtime, a drug rep brings a, whatever it might be, an unhealthy lunch, you're going to go nuts and just eat it like crazy, right? Along with the cookies and the donuts, because you're so hungry. And so the more you can get ahead of that and actually feed your body, give it fuel, like you're just going to do better throughout the entire day. So I think that's kind of the key.
Yeah, I really connect with what you're saying, and know our audience. This is really good information to as you're thinking through, how to apply this in my day and fit it in. And the first is the fitness side and making that a priority. And it doesn't have to be a 2 hour, complete full body workout. It's breaking it up. I think that's solid. You're building your foundation there. Then you just talked about kind of how do you fuel yourself for the day, and stay ahead of that, that crash maybe where you're also looking for something. And then let's talk, maybe I'd really like to kind of hear your opinion about kind of the mental aspect, right? You're going through something that's very, I assume, stressful. You're in a stressful environment, or, whether it's the learning phase, the actual practicing and, interacting with patients, I'm sure, stuff like that. Talk to me a little bit about how you've taken on, the mental side and stress management, as you progress through your medical career.
Yeah. I mean, personally, thankfully, my wife's also a physician, so she and I had each other to go through things. So that was super helpful. If you don't have that, you have colleagues and friends that you're probably going through things together. So you almost build this brotherhood, sisterhood of camaraderie and support. So that's like, I think, essential. Having someone to talk to, having someone to vent to, having someone who will listen to you and understand what you're saying, right? I think it's great to just talk to people, like maybe your mom or your dad, but they may not get it, right, if they're not in healthcare, or your siblings. But if you have someone who's in the trenches and understands what you're saying and truly listen to you, I think that's super helpful. So for me, that was really important. I had my wife, we started dating in college, we got married in med school, and then we were married throughout residency. So we always had each other, and we still do. And so that's been a huge, I think, part of my like mental sanity, throughout the years. And I think, in residency, it was interesting. I actually considered just quitting altogether. We had a resident who left. He had it. We had a kind of aggressive program. It wasn't, very fun, as you can imagine, at times. So he quit, and a lot of us were thinking, oh, you can actually quit residency. We didn't know that was a thing. So we started thinking, okay, maybe we'll quit too. We'll go find something else to do. But I started to really think about my why. Like, why am I doing this? Like, I'm not doing this to be verbally abused or mentally abused or whatever it might be, right? That's temporary. There's a clock to this whole thing. I'm here to learn. I'm here to learn because I'm actually going to help people and actually want to help people. So I think the more I focused on my why, and also the fact that my situation was a temporary one that was not ideal. I don't think actually it's probably the best way to train residents, but it's what I was dealt. And I think just being able to see beyond the now was like super important for my mental sanity, to know that it's going to get better and I'm going to get to do what I want to do. And thankfully that's how it played out. So I think knowing your why, knowing that it's temporary, and just trying to find people around you to be supportive is like really important. In addition to the other things I mentioned, but
yeah, that's awesome. It makes a ton of sense, to have that support. So one of the things that we do, get asked a lot about, or have talked across our different podcasts on our network, is that support group. And just it sounds like, you and your wife got married during medical school, right? So if you're unpack that a little bit, what's that like? I'm just curious if we were to give a peek into what is it, two ships crossing in the night? Because she's busy, you're busy.
Yeah, at times. Yeah. So med school different than residency. Med school first 2 years, I mean, it was pretty flexible. We would go study together. We were together all the time. It was actually very nice. third and fourth year, you're doing rotations, you're doing different rotations. Occasionally you might be on the same ones, but often you're in different ones. So that was a little bit more of the two ships crossing, at the night, basically. So after we got married, it was challenging for a couple of years. And then residency was very challenging because we went, college and first years of med school, seeing each other every day, all day, to going days without seeing each other potentially. And in residency, there were times where, for example, we had a thing called night float. So you might work a night call rotation while she might be doing days. And so, I would go to work before she's even home and vice versa. So we'd go, a week without seeing each other. And we do that every week for a month or two. And so those were the most challenging times. But I think being intentional is still, connect as much as you can, make the time you do have count. You can still support each other, leaving cards and messages and, just being there for each other, even though you're not physically sitting next to each other the entire time still works. And again, it's temporary, right? You kind of know this is not forever. So that kind of helps get you through it. But it was very challenging. I don't think anyone was like that, but we made it, but it was very tough.
Yeah, for sure. I think again, the theme is making it a priority, and it might not always be like we talked about with the fitness, 2 hours of your day or a full meal, or like the ability to sit down with your partner for long periods of time. But it's looking for ways to connect and be intentional and prioritize these things. And I think that that's an important message. If I were to kind of wrap all those together. So talk to me a little bit about, I've seen some of your posts on LinkedIn, talking about family, obviously, being married through your medical education and so forth. But talk to me a little bit about now, after you've gotten through that and you're practicing and stuff like that. I assume that support system is still very important to you.
Yeah. Oh yeah. Yeah. Probably more so, honestly. I think, you get through residency fellowship, you start then maybe having a family, having kids, you start getting even busier in ways that you ever were. It's just different, kind of busy. So carving out time, I think, for my wife and me is very, tricky at times. But again, you have to be intentional. You can't let that slip, and you got to make it a priority. But I have 3 kids, ages 3, 6, and 11. Great kids, but they're high energy kids. I mean, they keep us moving, and they're fantastic. But at times it can be stressful. We have a lot of family support too. We've got a lot of built-in friends and longtime babysitters that are now like family, which is also very important. But it can be very even more challenging, I think, in ways than residency, because you have you might have time together, but especially with little kids, it's mommy, daddy. You can't really sit down and talk as a couple when your kids are all around you. So you have to be careful not to say, well, we were together all day. That's not the same as my wife and I sitting down in the evening without kids to talk for several hours, like very different. So again, I think it's just knowing that, hey, this is a priority. We just have to be aware of what's actually going on. But it also can be, the theme is it can be challenging, right? But it can all work out. You just got to really work at it. It takes work.
Yeah. So just kind of continuing on that, I'd be curious to hear you talk a little bit about, you're going through a full day of practice and working with patients in various cases and working through that. And then you have to transition, so to speak, I'll use that word, or pivot into being a dad or a husband. Any tips that you would share on that you've learned along the way of kind of I'll say balancing it. I don't know if that's ever really a true balancing outcome, but
yeah, I think balancing, managing, balancing. Yeah, I mean, it is a balancing act at times, especially if you take, and most physicians, I won't say all, take call, right? So, I might pivot mentally on my way home. I have a drive, usually 30, 45 minutes. And so mentally I can kind of unwind, unpack, relax a bit, maybe call my wife, talk to her if she's free. And when I get home, I'm home. I'm not thinking about work. I'm not, on my phone. I'm trying to put that away, unless I'm on call, where I got to have my phone with me, and I might get called a lot. I might get called a little. I might have to go back to work. And so my kids don't ever like that, right? I might have to go back during dinner. But I think, again, it's all the other days I'm so intentional about making sure I'm involved and I'm there for them, and I'm putting them to bed. I'm reading stories. I'm wrestling with them. I take my kids to school in the morning, even pretty much every day. And so I think there's enough devoted time that's not distracted, that even when I am on call and I am a little distracted, I think I don't think it's is maybe harmful, I guess would be a word potentially, than if I was like that all the time, right? So again, I think it comes down to being intentional. What's my priority? My priority is my family when I'm not working, and what's my goal is to like make sure they know that, hey, I'm their dad and I love them and I want to spend time with them. So I got to like build things to like make sure they understand that, right? So, but yeah, it can be really tough when you're on call and you're going back and forth and you're getting called, but thankfully that's not all the time. And so I think it's setting up boundaries, I guess, when I can, and then knowing when I can't. You do have to juggle that a little bit.
Yeah. I think the word boundaries is probably super important through the whole stages of medical education, all the way into attending and right, it's having those boundaries. I mean, would you unpack that a little bit more? I mean, have those boundaries kind of changed? I'm just going off the cuff here, but around like technology or maybe charting, or I don't know, what type of boundaries are kind of sacred, if you're willing to share any?
Yeah, I mean, I think so. I think when you go through med school, let's back it up even to pre-med, right? Pre-med, I worked so hard. I'm like, I don't know if I'm gonna get into med school, right? So you got to work so hard, try to be your very best, because so many people apply and don't get in, right? So you got to almost go overboard, right? All you're doing studying, you're trying to score as best you can on every test all day, every day. Get to med school. If you want to go into a particularly competitive residency, it's the same thing. You now have to work hard. You got to do your very best. You got to try to score as well as you can, right? And so you go overboard, and you get to residency, and it's maybe a little different. There's still testing, but it's not quite the same. But you have attendings, you have real patients who depend on you. So you're trying to like do your absolute very best, because you want, number one, to learn the stuff so you can help people one day. Number two, you don't want to hurt people you're like actually taking care of now. And so there's this tendency to just go overboard, right? You're workaholic by nature. And for me, when I finished residency, I came out to practice. I didn't realize I was a workaholic. So initially I would get up early, like super early, and I would stay up late, and I would add cases on. Even when I'm not on call, I would go overboard, which is not necessarily a bad thing to do, but it can be very detrimental if that's not like your only role in life, right? So here I am. I have a wife. I have kids. I want to, be part of the family, right? And so those boundaries become very important when you can put them in. And like if you don't put in boundaries, like medicine is one of those things that will demand and actually take everything if you allow it, right? Like I could actually work 24/7 and probably never catch up. Like you just have to know that. But that's not normal. Like you shouldn't do that, especially when you're done, right? That's why you have more than one doctor in your group, right? Like it's not just you. Yeah. So, the boundaries have become more and more important as time goes on, because if you don't put them in, like you're just going to be a doctor and that's it. And so I think if, again, you focus on what are your priorities, what are your goals, like who are you? Yes, I'm a urologist, but I'm more than that. And so those boundaries become important to ensure you can be all those things you want to be. And that's not something that like is ever really taught. Like you kind of have to learn that once you get out of training, because in training, it's all I am as a resident. That's it. I got nothing else. And I have to give it 100% all the time. And you get in that pattern. It's kind of a bad habit to be in. And you have to kind of almost unlearn some of those habits. At least I did.
Yeah.
That makes sense.
Mm-hmm. Yeah, it does. And I think there's a ton of wisdom there for our audience to take in, and understanding that some of the stuff that you're working to achieve is, temporary. And then on the other side of that, is it can be different, and you can choose one, how you, the mental aspect of that, the stress management side of things, and how it defines you. And I think that that's really powerful stuff. And As we kind of continue kind of our time together, I'd like to unpack a little bit about like preventive care, and that gets into the fitness and side of things, and your passion there. Um,
Hmm.
it's a key. It sounds like it's been a key part of you as you've progressed through your career and
Hmm.
part of your family. Um, let's just unpack that just a little bit about how does that play a role in medicine from a doctor's perspective, right? You spend a lot of time, I assume, working with
Hmm.
patients or talking to patients about preventive care. But how does I guess
Hmm.
what I'm saying is how does a doctor put on their own oxygen mask?
Hmm.
With your
That's a good
culture?
one. Yeah, put yours on first. I mean, it's kind of important, right? If you're not healthy, you can't then go help others be healthy. So, and I think if you want a long career and a long, high quality life, then prevention's more necessary than ever, right? Like, I have patients that'll come in their 70s and 80s and they say, "Oh, I was so healthy until I came to see you." And I'm like, "No, you've not been healthy for years." And there's this concept, people understand taking your car in for routine mileage maintenance, but they don't understand routine mileage maintenance on your own body. And so it's the same thing. We're mechanical, we break down, but there's things you can optimize. I mean, for example, let's just take blood pressure, right? How many people in their 30s, 40s, 50s, they don't know they have high blood pressure? And that chronic high blood pressure then leads to kidney failure, heart failure, all sorts of problems when they could have easily been on probably a pretty minor medication or even lifestyle changes, honestly, that would have improved their blood pressure and prevented that diagnosis from ever occurring later on. Like it's actually this is like a real thing. Prevention is super important. Um, so for me, honestly, I think I've kind of indirectly done that just by being active, and the more active and I want to perform, I tend to eat better and try to optimize things. But I didn't actually realize I was actually doing preventive care until maybe the last 5 to 10 years. And so now I actually do more where I actually check my blood pressure. I check my labs, right? And so I don't even follow the guidelines based on what they tell me about checking my labs or EKGs, or I mean, I do more than they say I should do because of my body, right? I want this body to go for as long as I possibly can. So I need to know my blood pressure more than my family doctor needs to know, right? I need to know what my total testosterone is more than my family doctor does. I need to know what my electrolytes are and my cardiac risk factor markers. And so I think is med school residency. I never learned any of these things about personally taking care of myself, but I think is especially our audience that's younger and going through training. Don't forget that you also have to, like you said, put on your oxygen mask. So I don't know. I didn't have access to necessarily a routine clinic unless you could go like a walk-in urgent care type thing, but I didn't have a family doctor throughout really any of that time period.
Mhm.
But especially if you're somewhat non-traditional, maybe a little older, I mean, if you're going through training, you should be, getting labs and getting vitals and checking blood pressures and doing that routine preventive, care. It's super important.
Yeah. Um, you had a post on LinkedIn that talked about the blood labs, and I wouldn't remember it all off the top of my head, but that's what I was alluding to earlier. I take that post into my doctor and be like, "Hey, let's run all of this. This is good stuff."
Yeah. Yeah.
Uh, so again, we'll put those socials out there so people can go out there. But
Okay.
one of the
Yeah.
things that Dr. Hall does is on his posts, he really unpacks it and gets into just some good detail. And it applies obviously for consumer patients such as myself, but also the audience that we're talking into.
Hmm.
I was talking to a surgeon the other day, and he didn't have a stat on it or anything like that, but he said something to the effect of that sometimes doctors can be their own worst patient or something to that effect,
Hmm.
and that's
Yeah.
what I'm wanting or just kind of addressing here is
Yeah.
don't lose sight on taking care of yourself and that
Hmm.
preventive care and the stuff that you're talking about. Um,
Hmm.
one of the things I really wanted to ask you about is around burnout. Um,
Hmm.
we talked to residents and fellows and even what I would call people further in their medical career that this word burnout keeps coming up, and it it can mean in different things to different medical professionals, and they have different ways of describing it. But I guess when you faced burnout, or if you have, what do you use to counter that or
Mhm.
address it?
Yeah, I mean, burnout, obviously has thankfully become more of a buzzword in a good way, right? It's more awareness built around it and what it might be. I mean, we've studied burnout, we've studied things like it for like turns out decades. I mean, um, I just think we're really like describing it better, and especially in healthcare. But I even started to see in the last decade, not really knowing they were experiencing burnout, but colleagues who just seemed to start acting differently, right? And maybe use the term jaded or more negative, or everything was a trigger, right? And so like there's just this like overwhelming change in how they see the world, right? And so I would scratch my head and be like, what's going on? And I think it was just this constant. So one thing I've learned in the last couple of years is there's trauma, right? There's someone who goes to war and comes home, right? They experience tremendous trauma, rape victims, people attacked, motor vehicle accidents. That's big trauma, but there's also little traumas, right? So like, chronic low grade traumas that are repeated over long periods of time can do the same thing. And I think medical training, especially the one I experienced, was daily like traumatic, interactions, right? Name calling, belittling, gaslighting, like just it goes on and on and on for years, every day. Like that actually leads to like really horrible like things, like, and truly more than burnout. So back in residency, I didn't know the term burnout, right? So this is something newer that I've started to realize is a thing. But in the last few years, I think especially since COVID, like urology, we were pretty busy during COVID, right? If you can't urinate, you have cancer, you got a kidney stone. It's not like we could tell them to wait 8 weeks, like you could wait for a hip replacement or something. So we were actually really busy. Then after COVID, there was all this pent up demand, and urology is always short staffed. So I think there was a lot of burnout in the urology community in the last few years, and we lead in things like depression, suicide, ideation, burnout. Like we're at the top of those lists, and I think it's just because we're there's just not enough of us, and we just have so much demand placed on us. And when you take that, but you also throw in all the other life stressors, right? We all have families, we have kids. Maybe there's medical problems, maybe there's marital problems, maybe there's personal life issues, things that happen. And so, I mean, I think the first step is just to be aware, like anyone can burn out. And I think the things that lead to burnout or these chronic stressors over time, maybe more commonly than these big, like traumatic events that thankfully most people don't experience. But I think when you start to actually be aware of it, and then you start to try to structure your life around ways to minimize those stressors, that's going to be huge. So if you can prevent it, I think that's the biggest thing. So I think personally, I've been able to do that by just being observant around, who around me is actually burning out,
Mhm.
and then trying to prevent what led to their burnout. So one person that comes to mind is someone who got up early, stayed up late. They were clinical 100%, but they had all these other roles, right? They had all these other titles, and so they were constantly in meetings when they weren't like operating or seeing patients. And they had kids, they had multiple kids. The kids all had events, and so they were constantly going nonstop every day for years, and they burned out. I mean, you just can't maintain that pace,
Mhm.
nor should you, right?
Mhm.
Um, so I think building in rest, building in like a slowness to your life when most of the time it's very chaotic is really important. Um, because we're not built to go like that, I think is the is the
Yeah,
thing.
especially, in all kinds of professions. It's a go,
Hmm.
go, 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 go,
Yeah.
to achieve, I guess, quote unquote, success or climb the ladder. Different industries, it applies
Yep.
differently, or careers, I
Yep.
should say. So you mentioned rest. Let's talk a little bit about that. So
Yeah. It's
do you
important.
carve okay, do you carve out time for that? I mean, what does that mean? Is that a walk? Is that a sit in silence? Is that meditation? Is it physical, like actually sleeping?
All the above, honestly. And I'm not perfect in this, but I keep learning and getting better. So I will say the me now, the me today is very different than me even 2 or 3 years ago.
Mm.
4 years ago, I'd say 4 or 5 years ago, I really started to realize I need more sleep, right? 5, 6 hours like I used to do in residency is not enough. I need 7, 8, maybe more. So that's the first step. Try to get more sleep. Don't stay up late. Don't get up extra early, right? Try to maximize those starting sleep and ending sleep. And for me, it was really at times I think I'd stay up so late because I was on a screen late. I'd be watching a aggressive movie, gets me all amped up. I'd be checking work emails and getting stressed or trying to do charts, and I'm like all like worked up about thinking of these things. That's where you can start to put these boundaries in, right? I'm not going to check work email at 10 o'clock at night before bed. I'm not going to look at a screen. I'm not going to watch a stimulating movie. I'm going to, sit and talk to my wife for an hour before bed, right? Try to get more calm or something. And so, but sleep's the first step to rest. But then I think there is a mental aspect to it that this is the newer me that's figured this out more recently. And it's super important and rejuvenating, but meditation, that's fantastic. I had never done that until recently, but just pausing 10, 15, 20 minutes. And there's some great apps to help with this. There's music to kind of change your brain waves that have been very beneficial. Deep breathing when you're doing this. So sometimes I do that while I'm driving. Obviously can't close my eyes, but I can do the deep breathing,
Sure.
listen to some relaxing music. So that's kind of where I would do most of that. Let my mind wander into more, calm places. But at times it might even be naps, right? That weekend might actually take naps, right? I used to think that was a sign of weakness.
Mm-hmm.
I was told it was a sign of weakness for years from, attendings and things, and it's not actually. It's a sign of strength to rest. So I think sleep at night, rest, naps, meditation, just taking time, could be even a walk if you want, just to unwind. Those are all super important.
Yeah.
To kind of de-amp you, I guess.
Right. Absolutely. So as we kind of close up our time on this episode together, we've talked about some really great things from the actual fitness and carving out and making that a priority, to nutrition and fueling your body, creating some boundaries and how those do kind of evolve as you progress in your career, and a support network, and then making rest a priority. If just to kind of close out our time, if there was one thing or one theme that you would pass on to a resident right now, I'm sure you do in your current practice, what would that be? I mean, is it preventive care? Is it making yourself a priority, or how would you kind of summarize?
Yeah, I mean, it's a great question. I mean, I think about this sometimes. I think there's lots of possible answers. I think along the themes that we've talked about is really, if you're a med student, resident, even a new attending, even if you're a seasoned attending and even not in healthcare, whatever, I think look to the future, look 5 years, 10 years, 20 years, and not, I used to do that, but I'd look at it from a financial lens, right? A retirement planning lens, or a purely like objective data driven aspect. I wouldn't look at it as far as like, who do I want to be, like what do I actually want to be doing, how do I want to feel, like a little more subjective. I think those are the things that can really help you decide, if you're a resident, like what kind of practice environment you're going to go in, right? Like if you want to have a family, have more leisure time, hobbies, whatever it might be, that might change not only your location, but your type of practice. Like those are really important things to be honest with yourself and figure out, right? Because not every position or every location is the same. Some places you might find it very hard to build in boundaries as an attending. Other places you have much more autonomy to do whatever you want, as long as you're providing great care and providing, meeting certain metrics. And so I think if I could like give some advice, it would try to pay attention to those, pay attention to how you feel, how you want to feel, how you want your life to look on a day-to-day basis, and not from an objective data-driven point, like here's how much money I want to make, or here's how much money I want to have in retirement, but here's actually what I want to do in retirement. Here's what I want to do when I'm 40 or 50 or 60. Here's what I want to do when my kids are 5. Do I want to take them to school? or do I not want to see them all day? Like, these are all really important things. And if you don't like start to identify those like now, then it gets harder and harder to make changes later on.
Yeah.
But that's what I would say.
Yeah, it's so good. And I really appreciate your time today and coming on and talking through this stuff. And one of the things that I did want to mention to close out is Dr. Hall's been a big supporter of Influent and Influent Network, and we've had a great relationship. And I'm excited to announce that he's going to be having a podcast on our network.
Yeah.
Right? Yeah.
It's exciting. Yeah.
Yeah.
It'll be a good time.
Yeah, it's going to be great. We're super excited. So that's going to be a great podcast to keep your eyes out for, eyes and ears for that matter, as we work towards that and get that launched. So, Dr. Hall, it's been a privilege to have you on.
Thank you.
And to learn a little bit more about your experiences and your willingness to open up and share some of the things that you've leaned into through your career so far. And we are excited to have you on the network to really have a platform to dive deeper into these types of topics and other ones that we didn't get into in our time today. But how can people learn more about Fit and Fine? What's the best way?
Yeah. So obviously on the socials, I think on LinkedIn, it's Dr. David Hall, urologist. On TikTok's Dr. David Hall. On Instagram, you can basically find me more at the Fit and Fine. So it'd be Get Fit and Fine Now would be the Instagram handle. Or you can go on our website, getfitandfine.com. And there's a contact form, an email, links to our socials. So that might be the easiest. Just go to the website or just Google my name. You'll probably find me too. But
he puts out great content and is a great follow. And we will put those again in the show description. And Dr. Hall, thank you so much for taking time. I know
you're welcome.
You're busy. Privileged to get to talk to you and get to know you a little bit better. Thank you.
Yeah, thank you. Yeah, it's great being here. Appreciate it.
I'd like to thank Dr. David Hall for joining us today. I hope our conversation shed some light on how to prioritize fitness in your busy life. Stay tuned for more discussions on important topics in the medical field. And one way to do that is to like and subscribe so you'll never miss an episode of Unscripted. I've been your host, Bryce Curry, and we'll see you on the next